M-mode echocardiogram showing movements of the interventricular septum and posterior wall of the left ventricle. Right ventricle is seen above the interventricular septum. This is an image from the parasternal view. Right ventricular free wall is adjacent to the chest wall with no echo free space in between. If there is echo free space, that could be either a pericardial effusion or a pericardial pad of fat. In systole, the posterior wall contracts and moves anteriorly. Normally, the interventricular septum should contract and move towards the posterior wall in systole. See the inset for normal septal motion. Here the septum moves away from the posterior wall in systole. This is paradoxical septal motion marked by pink arrow. This occurs in situations of right ventricular volume overload like atrial septal defect and severe tricuspid regurgitation. Interventricular septum is a common wall shared by the left ventricle and right ventricle. Normally, it contracts with the left ventricle. That is why when it does not contract in synchrony with the left ventricle, it is known as paradoxical septal motion. The paradoxical motion is due to change in the shape of the left ventricle. Normally, the left ventricle is circular in cross-section in both systole and diastole. In right ventricular volume overload, septum becomes flat or even concave towards the right ventricle in diastole. This curvature reverts in systole, producing the paradoxical septal motion. The authors of the cited study concluded that the diastolic change in the shape of the left ventricle due to right ventricular volume overload is the reason for paradoxical septal motion. Volume overload is also called diastolic overload. In M-mode echocardiogram, the vertical axis is the distance from the transducer and the horizontal axis is time. That is why it was called time motion or TM mode earlier, now abbreviated to M-mode.